Highlight Penn Medicine LGH's agreement
Closer.
to service to the Lancaster community. My name is Ann and I'm one of the co-coordinators of Lancaster HRC. A member of the Poor People's Campaign, a national call for moral revival, and an advocate for survivors of domestic and sexual abuse and adoption reform. We'd like to thank all of you, the National Union of the Homeless, and the Party of Socialism and Liberation for joining and standing together with us in solidarity today. Despite professing to provide specialty care when and where we need it most, you'll hear stories today that prove just the opposite. We're here to say that we aren't grateful for the substandard care currently provided by Penn Medicine LGH, as many say that we should be, because at least we do have one hospital left, and we're demanding the care that all people deserve, because it be provided. We want to make it clear that we do not blame the staff or hold them responsible for the compromised care they're being forced to provide, but rather their profiteer, Penn Medicine.
Yes.
Today's information and stories just scratch the surface. And we know that you may also have stories about your treatment at Penn Medicine LGH. And we encourage you to share them with us to help us in our efforts to hold Penn Medicine LGH accountable for their actions. Tammy Rojas, another leader in PPF and the Poor People's Campaign, a national call for moral revival, will give us some background on PPF and explain why we're taking action against Penn Medicine LGH today.
All right, hey everyone. So my name is Tammy Rojas. I'm a leader with Put People First PA. I'm actually a member of some of their statewide teams, base building, the campaign team, and the media and communications team. Put People First PA is a grassroots human rights organization led by the poor and dispossessed, campaigning for health care as a human right, and we're leaders in the Pennsylvania Poor People's Campaign, a national call for moral revival. We are taking action on Penn Medicine, part of the University of Pennsylvania system today, as part of the Put People First PA's statewide week of action. This past week, there have been Medicaid marches in Johnstown and in Philadelphia. Now today, in Lancaster. There are people coming around that have petitions for our public health care advocate for Pennsylvania. As you can see, they're holding them up there. A public health care advocate would manage an office whose sole staff would protect people's rights in the healthcare system in Pennsylvania. Please sign up in support of the public health care advocate, or to maybe get involved with our work, or subscribe to our bi-monthly e-news, or be added to our contact list for future actions. There is also someone coming around collecting donations as well to help us with our local work. Thank you. Okay, so what we're going to do with this kind of explaining the situation today is we're going to be here, we're going to have some speakers, and then once the speakers are finished here at the square, then we're going to march down Queen, turn up Chestnut, and then continue on down to Duke Street until we're outside Penn Medicine LGH. And then when we're there at the hospital, we'll have 2 more speakers. So I just want to kind of share that the Philadelphia Healthcare Rights Committee is also dealing with the hospital closure in their community, just as we have here. The Hahnemann Hospital closure is affecting Drexel University medical students. The poor and dispossessed will have less access to care. Emergency room wait times will skyrocket as they have in Lancaster. The Philly HRC is fighting back against a real estate deal that could turn the former hospital into luxury condos.
Boo!
In Lancaster, just like in Philly, there are similar things happen here. Both hospitals within Lancaster city limits owned by corporations connected to universities. The University of Pittsburgh Medical Center, UPMC, and University of Penn Medicine. University of Pennsylvania, Penn Medicine. We still don't know what's going to happen to the hospital UPMC closed against the wishes of the community. There's been a suspicious recent sell and purchase of the medical arts building across the street from the closed hospital, the one that we know as the old St. Joseph Hospital on College Avenue. UPMC leases out of there, but it was bought by a random named LLC that actually has an office in Delaware, which it shares that space with 250 other companies. Right away when that hospital closed, there was talks of housing on the location of the old St. Joe's. It began immediately once closing was announced. It wouldn't be housing for the poor. So the poor lose a healthcare facility, which could lead to them not getting the care they need. Gentrification of our community is pushing out the poor and leading to a rise in homelessness. The poor gain nothing from this. The poor gain nothing from this, only pain. This is why Lancaster needs a homeless union and a healthcare rights committee.
Yeah!
We need to unite and fight these issues together because these issues are interlocking injustices and lead to poverty. We need to fight and organize for our basic human rights to housing and healthcare.
Yes.
Today, we are taking action to defend Medicaid, demand our right to health care, and bring to light the false narrative that says the poor. The false narrative that says the poor are the ones abusing the system. Politicians like our representative, Scott Martin, introduced bills to instill work requirements on Medicaid with the false claim of cutting costs and the end abuse of the system by the poor, leaving the people he represents questioning who will be impacted and just what are these so-called savings. That same energy could be used in implementing our policy vision for a public health care advocate for the state of Pennsylvania, because we know it will work. A public health care advocate would protect our rights in the healthcare system. We have them for utilities. You get overbilled or have an issue with a utility company, you can call the PUC. Other states have public health care advocates. Why not Pennsylvania? Since 2005, Connecticut's Office of the Healthcare Advocate has returned $92 million to the Connecticut residents, including more than $10 million a year each for the last 3 years. They have done this by helping thousands of residents challenge overbilling by the providers and denials of coverage and insurance claim by insurance companies. Connecticut's Office of the Healthcare Advocate has saved the state's Medicaid and CHIP programs more than $4 million over just the last 6 years. They have done this by saving the state from having to pick up the cost of insurance claims that insurance companies have wrongfully denied. Pennsylvania has a population of 3 to 4 times as large as Connecticut. So Put People First PA estimates that a Pennsylvania Office of the Public Healthcare Advocate would return $30 to $40 million to Pennsylvania residents every year. All of this information comes from the OHA's 2017 annual report. If we had a public health care advocate, the abuses of Penn Medicine would not occur. The reality is healthcare profiteers like Penn Medicine who are abusing the system. Poor people are not the problem.
That's right. That's right.
In 2017, May through December, Penn Medicine, Lancaster General Hospital swindled poor and dispossessed mothers in our community by submitting false claims to Medicaid for obstetric ultrasounds. Many of these were high-risk pregnancies who needed results in a timely manner, but did not receive them, sometimes not until the babies were delivered.
Hey, right?
In a recent article found on WITF website, it stated Penn Medicine has agreed to pay $275,000 to the Department of Justice to settle allegations that Lancaster General Hospital submitted false claims to Medicaid for obstetric ultrasounds. And I'm thinking, agreed? So they had a choice in that? Penn Medicine received what was called a slap on the wrist with a feather by the doctor who was the whistleblower on the issue. Now imagine, we only found out about this because a doctor came forward after he tried to first get Penn Medicine to rectify the situation. Expectant mothers are not the only Medicaid recipients who should be concerned with how Penn Medicine LGH conducts their health care services. Penn Medicine LGH was already over capacity prior to the old St. Joe's being shut down by UPMC. Now, things are worse. With only having one emergency room within city limits now, we are not equipped to handle a serious emergency. The workers of the hospital are overworked, understaffed, and the community is upset because they feel rushed through the emergency room. Many express feeling like nothing but a number, which could be why we have seen an uptake in emergency room walkouts. An article in the Lancaster newspaper stated that the amount of people walking out of the emergency room at LGH went up. From 59 people walking out reported in March of 2018, up to 308 people walking out without getting care in March of 2019. March of 2019 was the first month without a second hospital in our community. UPMC closed the doors at 250 College Avenue at the end of February 2019. I'm dismayed that Penn Medicine gets to slide by on their crimes and rub it in by bragging about their new fancy dining hall they are getting, thanks to the permission they received to expand. Seems convenient, in fact, more beneficial for them that UPMC closed the old St. Joe's Hospital. Today you will hear about how this has impacted people in the community, the concerns we have, and why we must demand better and hold the people responsible for this war on the poor accountable. We ask the community, if you have been affected by the actions of Penn Medicine, please come forward. Put People First PA will stand by you. You don't have to face this alone. Feel free to reach out to us. Put People First PA demands the following today. A public health care advocate for Pennsylvania. Woo! Woo! No cuts, no hoops or hurdles to Medicaid.
Yes!
Also known as welfare insurance. Stop the attacks on Medicaid.
Yes.
And restore the adult dental benefit.
Woo!
We all need health care. It's our basic human right. It's time to end this war on the poor, and it's time for the community to stand by the poor and decide which side you're on.
Fantastic.
Now Jacob Butterly is going to lead us in song.
Hello. Alright, am I nice and loud? Assuming I am.
Close.
So my name is Jacob Butterly. I am a musicologist with the Poor People's Campaign, a national call for more revival, and a proud member of Put People First PA.
All right.
And so I live right outside of Philly, and Tammy kind of touched on this. Hahnemann Hospital, which receives the most number of Medicaid and Medicare recipients in the city of Philadelphia, has been closed because it was purchased by this billionaire named Joel Friedman, who is going to make $80 million off of converting the building the hospital has been in to high-end real estate.
Where's our money?
Messed up.
Whoa.
And this, along with the closure of UPMC, is a systemic war on the poor. There have been dozens of hospitals, mostly rural, closed across this state since 2000. This is class warfare to eliminate the services that we need to survive. And so, in the Poor People's Campaign, we do a lot of singing because we believe that singing is an act of solidarity that we can take up with one another. So I'm going to teach you a song called Which Side Are You On? Alright? So, Which Side Are You On? To give you a little bit of history, it was written by a woman named Florence Reese. She was the wife of Sam Reese, who was a coal strike leader in Kentucky. I believe it was Kentucky. Don't quote me on that. Harlan County, Kentucky, which lasted for almost 10 years. The way the story goes is that J.H. Blair, the coal company, paid off the sheriff and a couple of his goons to break into Sam's house and beat him to death. They got tipped off and Sam hid at a friend's home, but Florence wasn't let known, so her and the kids were home when they broke in, set fire to a bunch of furniture. When she went back inside, she ripped down the calendar and wrote the words of these songs. So, the chorus that you're all going to help me out goes like this. Which side are you on? Oh, which side are you on? Which side are you on? Oh, which side are you on? Y'all do that with me?
Absolutely.
Alright, let's try that. 1, 2, 3. Which side are you on? Oh, which side are you on? Which side are you on? Oh, which side are you on? See a lot of people not moving their mouths. If you think that you can tackle systems of oppression but you can't sing with the people to your left or your right, then I'm afraid you're going to fail miserably. Let's try one more time. Oh, which side are you on? 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 They say in Harlan County there are no neutrals there. You'll either be with the Union or a thug for J.H. Blair. Which side are you on? Oh, which side are you on? Which side are you on? Oh, which side are you on? My mama was a worker. She's in the clouds and air. And when I'm with the Union, I know that she is there. Which side are you on? Oh, which side are you on? Which side are you on? Oh, which side are you on? My daddy was a miner, and I'm a miner's child. And I'll stick with the Union while our enemies run wild. Which side are you on? Oh, which side are you on? Which side are you on? Oh, which side are you on? Again. Which side are you on? Oh, which side are you on? Which side are you on? Oh, which side? side are you on? Come all of you good workers, good news to you I'll tell of how the poor people's campaign has come in here to dwell. Which side are you on? Oh, which side are you on? Which side are you on? Oh, which side are you on? Last time. Which side are you on? Oh, which side are you on? Which side are you on? Oh, which side are you on?
Our first speaker today is Kim, a member of PPF's York HRC. His story is a compelling one, highlighting the struggles that many face when attempting to navigate the healthcare system we have today and why we need healthcare for all and a public healthcare advocate. Another connection that he has with Lancaster is that UPMC also entered York when they bought a hospital there when they bought St. Joseph's.
All right, Kim.
Hello, my name is Kim, and I'm here from Cross River in York. I'm here today in Lancaster as a member of PPF, Put People First, and as a lifelong medical patient. In 1968, my mother was due to deliver me in mid-February. January 15th, she went into labor first thing in the morning, and that day I was delivered. About a week later, my parents were in York Hospital to hear the news that I was one half of a set of conjoined twins, and my brother had failed to develop when the weight stuck. They told my father that my mother would survive. However, no one with my medical condition had survived past 6 months. My parents, a week later, were told that I should be sent to a facility where I would wait the inevitable. My parents decided not to do that. They decided to take me home. And today, 50 years later, and more than 60 operations, I stand here to talk to you about the failing healthcare system here in America. I can remember when Blue Cross and Blue Shield had community ratings and everyone paid the same. It was a true nonprofit, and it was regulated at the state level so that it worked for the good of all people. In the late 70s, for-profit insurance companies came into the market and undercut the Blue Cross and Blue Shield system by providing insurance only to those of the most healthy.
Boo!
I remember in the 80s, the rise of the HMO, insurance by doctors. And finally, a system so expensive, many of us cannot afford even basic health care as it is rationed out to us. This and more leads to a slow and steady decline in medical care. One reason we are here today is to demand a public health care advocate, sometimes called an omnibus. The job of this advocate would be to help protect all residents of the state of Pennsylvania from abuse by private and public powers in our dealing with the healthcare system. The office would accomplish this in 3 ways. First, provide direct assistance to people who are struggling getting health care, such as helping enrollment, getting coverage, and challenging denied claims and negotiating bills. Second, working with community groups and public agencies to educate the public about our health care rights. And we do have health care rights.
Right. Straight.
Third, to work with legislators and public agencies to report on how the health care insurance system is working and provide lawmakers recommendations to improve policies and practices. We know this system works because PA already has advocates
for long-term care, public utility, employment, and housing. Also, several other states have public advocates who hold both private and public insurance companies accountable. Such a position must be created through our legislature so that it has the funding and authority to do its job properly. I hope that everyone here who hears my voice will stand with us today and demand from our legislators a Pennsylvania state health care advocate.
All right, thank you, Kim. Okay, so our fight to take back St. Joseph's led us to examine the issue of housing in our community. We had to, because people jumped to talks of housing when the closing was announced. We kept saying we have a need for both, and therefore must fight for both, and we have been working hard to try to get that message realized. Some people in our community thought we could get affordable housing and get the homeless off the street. In reality, once 250 College Avenue is rezoned, which is what's been talked about, even as residential, there is no guarantee it would be affordable housing. Whoever UPMC would sell it to could develop what they wanted, and many in the community are concerned it's going to be luxury condos or another otherwise unaffordable housing. A developer could get incentives to put in some affordable units, but the way it's been going in our community, that comes to only about 10% of the units in whatever said building. Gentrification is happening rapidly in our small city, and we are feeling the effects. The rise in house flipping, downtown upscale development of our rural farms, beautification, all of this interconnected is causing an increase in homelessness in our community. Environmental issues are causing homelessness to rise in our community. Lancaster County needs a homeless union to organize and address these issues, and that's why we are happy to have been joined by the National Union of the Homeless to stand with us in solidarity and announce the start of the Lancaster Homeless Union. We will now have the folks from the Homeless Union come up, and if you're interested in being part of the Homeless Union, please join us after this action for dinner and a meeting. We'll talk more of that later. Here are the folks from the National Union of the Homeless.
All right.
Wow, that's you, my friend.
Hello everyone. My name is Robert Aguirre and I'm from San Jose, California. I represent the people in Santa Clara County. Every 2 years they do a point-in-time count, and that point-in-time count has increased from 2 years ago, about 3,000 people to over 6,000 this last time. The number of people that have died in the streets 2 years ago was 68. Last year, 158. This is a sign of the decline of the health care for the people, for the care of the people, housing of people. So what we're working for is to provide better conditions, including health, for all the people, not just the people that own homes. Thank you.
My name is James Shura, and I'm from Boston, Mass. Healthcare is a human right. Period.
Yeah.
That's right.
There is no reason why, because we're poor and we're homeless, that we shouldn't get proper health care. It's absolutely ridiculous. Closing hospitals, letting people die on the street. We are all human beings. And it's about time that the powers that be wake up and realize that. No, they ain't gotta wake up. we will wake them up. And they will realize just that.
I'm Stan Eckstein. I'm from Marysville, California, Yuba City, and I'm here. We support healthcare for everybody.
Yes.
Rich, poor, everybody. Everybody deserves the right to live.
That's right.
Everybody. Hi, my name is Wes White. I'm from Salinas, California, part of the Homeless Union, California. And certainly we see a lot of people go in, they say that they've got trouble, and there's paramedics that won't even take them. You know, you go to the emergency room and they say, oh, well, you just want to get out of the street, get back out there. You know, and so what you're fighting for is real. People are dying because we're not getting health care. And thank you for doing this, because, man, it's time for health care for all.
Hey everybody, my name is Sabina. I'm from Massachusetts, the Massachusetts Union of the Homeless, and healthcare is a human right. We stand in solidarity with you. It is time for us to unite the poor and the dispossessed across this country. I'm here representing also Treatment on Demand, which is a coalition that's built around the opioid epidemic, and Treatment on Demand stands in solidarity with healthcare, knowing that it's a human right. It's not an issue of drugs, it's an issue of human rights. Chemical warfare equals the opioid crisis equals a health crisis, right? And we need to put people first. So we stand in solidarity with you, the National Union of the Homeless.
That's right.
Hi, my name is Rita Acosta from Salinas, California, and everyone needs health care. They say we don't have it because we don't work. My daughter works very hard to take care of her family, and she right now needs heart surgery, and she doesn't have insurance, so she's just waiting. And I feel like, don't we all deserve a chance to live?
Yes.
Yeah.
Yes.
Hi, I'm Susan Eckstein from California. I'm an executive for the city. I'm here for everybody to get health care. We're all homeless. We all deserve it. Even if you want to help us, we all deserve it.
All right. Thank you.
Hi, I'm Keith McHenry, and I'm with the Santa Cruz Union of the Homeless and the co-founder of the Food Not Bombs movement. So I've been homeless 5 times, and every single time was a result of a healthcare crisis. So this is directly linked to homelessness, and there's a great many of my friends on the street who are on the streets because of the healthcare system. I remember back when in Tucson, when I was living on the streets, a company called me wanting $25,000 that day. I told the young man, who was very insulting, using swear words, that if I had $25,000, I would rent an apartment, and that's where I'm going to spend my money next. And fortunately, through persistence, I was able to get those charges for having gone to the emergency room dropped, but it was quite an effort. And there's many, many thousands, maybe millions of us out on the streets today who are on the streets directly as a result of this failed healthcare system. So we are here in solidarity with this effort, and we're for healthcare for all. And just like food is a right and not a privilege, healthcare is a right and not a privilege.
Well, my name is Anthony. I'm from California Homeless Union, and it is a real honor and a privilege to be with you guys here in Lancaster, Pennsylvania. I was doing a little background research and learned that Lancaster at one point in 1777 was the capital of the United States.
was the capital of the United States during the Revolutionary War. So we got a new Revolutionary War underway, and it's a war against us now, but it's going to become a war for our rights to health care, to housing, to treat like human beings. So maybe we can make Lancaster a capital again, make it a new kind of capital. A capital where us fighting for health care for all team up with a homeless union movement because it's one and the same fight. Am I right about that?
Yeah!
Okay, so the fact of the matter is that you can become homeless because of the health care crisis, like Keith was describing. The percentage of people who have been rendered homeless because of health care, because they couldn't afford it, because they had to sell everything and become bankrupted and pushed into the streets is growing every single day in this country. Then by the same token, those who are already homeless have absolutely no access to health care. They're dying on the streets. The number of people that are dying on the streets of America is absolutely unacceptable. And it happens summer, winter, spring, and fall. So we're determined to build this, to revitalize. We had a national union 30 years ago. Some of us go back that far. We're teaming up, some of us old guys and old gals, with some of these younger people coming out of the shelters, out of the streets, out of their cars, out of their RVs, doubling, tripling up in apartments to build a movement that is this time around going to succeed. We're going to build this mass movement. Am I right about that?
That's right. We're homeless, not helpless. We're homeless, not helpless. We're homeless, not helpless.
All right then. That's our slogan, homeless, not helpless, because all these people is, oh yeah, the poor homeless, throw them a nickel, throw them a dime, give them a sandwich, have a Thanksgiving dinner for them. But they don't care about the day after Thanksgiving. So what we do with the homeless unit is we have our own day after Thanksgiving dinners. We organize it, we cook, we serve people, we say we're still hungry. Not just one day out of the week, not just one night during the holidays, but 365 days a year. In a country that throws away more food than there are people to feed. We can take care of these things. Build a house in 45 minutes on an assembly line, and you got human beings living in a cardboard box. I tell you what, we're going to win this time around, but it's not going to be easy. And we're going to have this meeting later on. We're going to talk nuts and bolts of how we kind of mesh these movements together and come out of here with a strategy and a plan going forward. Because there's only going to be more homeless, there's only going to be more people thrown out, and they're building their army for us. All we got to do is supply the leadership to that army. Am I right about that? Yeah. All right, homeless, not helpless. Thanks so much for having us. We look forward to our discussions later on tonight.
Woo!
Thanks, Tony.
I can't follow that.
Kristen, hiding in the corner.
Hi.
And hi.
Hi, I'm Kristen Colangelo. I'm very happy to be here with my brothers and sisters and siblings from both Put People First. I'm a proud member of Philly Put People First, and I'm also a member of the National Homeless Union. And I mean, my brother in arms, Anthony, really covered it all. But I just want to say, you know, we've been sitting around telling a lot of stories this week, and one of the really heart-wrenching stories was what people have to go through when they need to go to a hospital. And one of the most heart-wrenching, they're a couple, but one I heard was somebody saying to their loved ones, you need to clean me up before you take me to the hospital so that I look worth saving. And I want to know what kind of society it is where people have to say that, where you have to look worth saving. And that's horrendous. It's not a society I want to live in. We're supposed to love each other. And people drive by and call us names. You can call me whatever. I've been called every name in the book. But there's some names I'm proud of. And that's the name that's fighting for a society that ends a system, that kills people every day on these streets, that makes them homeless when there's more houses, that starves them when we throw away more food. This is not a society that is just and that I want to be part of. I want to make a new society, and our mission says a new human being. And that's why I'm here with all of you today, proud and strong, and we're going to do this together. That's the only way we can do it, is together across all struggle. We're going to unify our class across all struggle. That's the only way we can do it. We've got to get over how they divide us, and they will keep dividing us if we don't say, no more. No more. No more. Martin. No more. No more. No Our next speaker is Nick, and he's representing the Party of Socialism and Liberation.
Hello.
Phil, are you cool? Do you need some water? You good?
I do.
Yeah? There you go.
How y'all doing?
Pretty good.
I know it's super hot out here, and I know we have a whole march, so I try not to go too long. But let me hear y'all out there again one more time. So I'm a member of the Party for Socialism and Liberation. So I want to just express my solidarity to the Put People First movement, or the Put People First organization, and local organizers, and the National Homeless Union. We're in strong solidarity with the work that they're all doing. Oh, sorry. Oh, there we go. Okay.
Much better.
So I was just saying that I'm in solidarity with everyone here. Awesome. So unfortunately, one of our members really wanted to be here, but they had to work because we're a party and a movement full of working people. But she wanted to just share her story here. So this is a member of PSL, local organizer Faith. So after having to, here it is. It was late last summer. I woke up before 6 a.m. Excited like a kid on Christmas morning. I had finished my last dose of antibiotics several nights before in preparation for the morning tooth pull. Finally, the tooth, which had cracked several years ago at work after hastily scarfing down BLT sandwich during a 12-hour work shift with no breaks, was taken care of. I would be taken care of. I was filled with the type of joy of seeing a dentist that only someone living without health insurance for almost their entire adult life, nearly 20 years, could feel. I felt relief. I also felt the weight of time. I knew I would only be covered under Pennsylvania's expanded Medicaid for a short time. I was in between jobs that summer, and while I had filled out forms for expanded Medicaid, almost immediately after my last gig was over, it took approximately 2 months before coverage would kick in. And by that time, I desperately needed to get back to work as bills were piling up. I had a very short window. So after arriving to the dentist's office, I announced to the secretary that I was here for my appointment. She said, "I'm sorry. We were trying to call you, but your insurance has been canceled. The state had caught up with me with my new job. My meager take-home pay had disqualified me from receiving more assistance. It was over. The window had closed.
Jeez.
My tooth would remain untreated. Wow. I am lucky, however, that I had a strong network of caring comrades, one of whom immediately created an online fundraiser for the cause. My new health insurance was now a GoFundMe campaign. I was as grateful as I was to my friends for helping in this emergency. It was not a solution. For myself and many others working class folks, I had to beg for money just to get a doctor. Almost a year after paying donated cash to take out my tooth, I finally found myself in a similar situation. I was unexpectedly laid off in August, and again I immediately applied for expanded Medicare. This would be my shot to see a dentist again. As soon as my Medicaid card arrived, I had a short window before I had to go back to work. I was able to get that comprehensive dental exam before the window closed again, but I still need a lot more work. My story is just one of millions of stories of working class people struggling to have the basic human rights fulfilled. Under capitalism, our healthcare is used to make a small group of people billions of dollars. Healthcare is a human right, and we must build an independent working class movement to fight for universal healthcare for all. Although I'm not here to join you today, I am dedicated to building this movement and building a world that enables the whole working class to live in dignity. So thank you all for being here. Oh, yeah, let's give it up for Faith. Yeah. So again, I just want to thank everyone for having me here, express my solidarity to Buck People First and the Homeless Union, and also express my solidarity with the workers, the staff of LGH, because it's their work that makes the billions of dollars that the CEOs and those at the top. So solidarity, thank you, all power to the people.
Thank you, Nick. Now Tammy will just tell us a little bit about the logistics of the march.
All right, everyone, so just as a reminder, we're going to be marching down Queen Street here. We're going to go down Queen Street on this side, down till we get to Chestnut Street. So we have the joy of passing the brand new Starbucks. And then we're going to kind of like turn up Chestnut Street towards Duke. And we're going to cross the street right there at Chestnut and Duke and keep following Duke up till we get to the hospital. And there'll be chants and songs and things like that on the way. And then we'll have 2 more speakers once we get outside the hospital. So we're going to gather everyone up and get ready to march. And then we're going to have Jacob lead us in song. But just to get everybody warmed up, if we just want to kind of do the Put People First chant, it's put people first. 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 Put people first.
They're talking about
the tenants who got the for that. I don't know what they think they can do.
Right.
So, March, we're going to sing a song. At Small Coverage Union, called Rich Man's House. From the seven, quite a few people here know the words. So, I'll teach it to you. We're going to go. And then you just join in as you know it. Alright? Well, I went down to the rich man's house and I took back what he stole from me. Took it back my dignity. Took it back my humanity. And now he's under my feet, under my feet, under my feet, yeah, under my feet. Ain't no system gonna walk all over me. Everyone got that? It's really important, that last line. Ain't no system gonna walk over me. Because we're not talking about Trump. We're not talking about Joel Friedman. We're not talking about Wolf alone. We're talking about the systems that enable them, the systems that give them power, the systems that let them decide that we're poor enough to die on the street, right? And we're going to dismantle those systems. Alright. Well, I went down to the rich man's house and I took back what he stole from me. Took it back my dignity. Took back my humanity. Now he's under my feet, under my feet, under my feet, yeah, under my feet. Ain't no system gonna walk all over me. Welfare office. Well, I went down to the welfare office and I took back what they stole from me. Took back my dignity. Took back my humanity. Now they're under my feet, under my feet, under my feet, yeah, under my feet. Ain't no system gonna walk all over me. This one's a little different, I'll sing it once. Well, I went down to the IS office and I took back who they stole from me. Took back my family. Took back their humanity. And now they're under my feet, under my feet, under my feet, yeah, under my feet. Ain't no system gonna walk all over me. Governor's office. Well, I went down to the governor's office and I took back what he stole from me. Took back my dignity. Took back my humanity. Now they're under my under my feet, yeah, under my feet. Ain't no system gonna walk all over me. UPMC. Well, I went down to UPMC and I took back what they stole from me. Took it back, took back my dignity. Took it back, took back my humanity. Now they're under my feet, under my feet, under my feet, yeah, under my feet. Ain't no system gonna walk all over me. Go back to rich man. Well, I went down to the rich man's house and I took back what he stole from me. Took it back, took back my dignity. Took it back, took back my humanity. Now he's under my feet, under my feet, under my feet, yeah, under my feet. Ain't no system gonna walk all over me. So that last line got real sweet. Ain't no system gonna walk all over me. Last time. Ain't no system gonna walk all over me.
It says walk, guys.
Says walk, walk, oh, sorry.
Alright, this is an interesting story about this building.
Yes. Let everyone catch up.
Stop for a second, guys. Stop.
Please.
Stop right there.
Yeah, that's plenty.
Tammy, you want to tell a story? No, just talking.
Oh, hey. Yeah, so this is an interesting story. This was, there was a little bit of a ruffle and fight in the community about the whole development of this building here.
Make a hole.
Make a hole.
The homeless folks used to kind of come down and hang out here in Vince Park. They still do somewhat, but it's been very aggressive with the signage, the bars on the benches, as well as narratives in the community and the media with local power holders and the nonprofits basically saying, don't give the homeless money, give us money because you're trying to help them. We can plan it better than they can, kind of thing. So that's this whole area basically that's been happening over the past year or two because of the deal that went down to build this building. You know, they don't want folks like us hanging around down here because they want a certain image in Lancaster. And it's really interesting that the outcry that we saw on social media when that sign went up basically announcing the new Starbucks in Lancaster. I just find it interesting that, you know, there's people that'll sit there and moan about it on social media, but then don't get out in the streets to actually like say something. So I just thought it would be interesting to stop here for a second and just highlight the reality of what's going on in our community. People in power would say there would never be a Starbucks downtown Lancaster. Well, now we have one.
When the working class is under attack, what do we do?
Stand up, fight back.
When the working class is under attack, what do we do?
Stand up, fight back.
When the homeless are under attack, what do we do?
Stand up, fight back.
When poor folks are under attack, what do we do?
Stand up, fight back.
When the hospitals are under attack, what do we do?
Stand up, fight back.
When the hospitals are under attack, what do we do?
Stand up, fight back.
When the homeless are under attack, what do we do?
Stand up, fight back.
When the planet is under attack, what do we do?
Stand
our communities in Appalachia. It's called Somebody's Hurting My Brother. So, it goes like this. You guys can pick it up as we go along, alright? Oh, somebody's hurting my brother, and it's gone on far too long. I tell you it's gone on far too long. I beg you, it's gone on far too long. Somebody's hurting my brother, and it's gone on far too long. And we won't be silent anymore. So you can't do the whole thing, at least come in there on the end. Alright, you guys can manage that? I believe in you. Let's try it again. Oh, somebody's hurting my brother, and it's gone on far too long. I tell you it's gone on far too long. I beg you, it's gone on far too long. Somebody's hurting my brother, and it's gone on far too long. And we won't be silent anymore. Now listen, boys, let's do sister next. Come in on that far too long, and it won't be silent anymore. If you can't, do the whole thing. I trust you. Alright, ready, set. Oh, somebody's hurting my sister, and it's gone on far too long. Yes, it's gone on far too long. I beg you, it's gone on far too long. Somebody's hurting my sister, and it's gone on far too long. And we won't be silent anymore. Somebody's poison the water. Somebody's poison the water, and it's gone on far too long. I tell you it's gone on far too long. I tell you it's gone on far too long. Somebody's poison the water, and it's gone on far too long. And we won't be silent anymore. Somebody's hurting the homeless. Somebody's hurting the homeless, and it's gone on far too long. I tell you it's gone on far too long. Tell you it's gone on far too long. Somebody's hurting the homeless, and it's gone on far too long.
Nice.
And we won't be silent anymore. Say that again. And we won't be silent anymore. And we won't be silent anymore.
No, we won't.
Healthcare is a human right. Healthcare is a human right.
Healthcare is a
fight. Healthcare is a human right. Fight, fight, fight. Healthcare is a human right. Fight.
homeless, not helpless. Homeless, not helpless. Homeless, not helpless. Homeless, not helpless.
The other thing about that property that's being built over there is I went down and I had lunch with the construction workers. And they actually were so aligned with us, they were actually...
I know an old
Just keeping the...
like this.
Right, you can make it fun next time.
Except for the first word. So it goes, raggy, raggy are we, just as raggy can be. Oh, we're gonna get something for our labor, but raggy, raggy are we.
Now this is where we're crossing.
Landless, landless are we, just as landless can be.
Thank you!
Oh, we're gonna get everything for our labor. Union are we? Homeless, homeless are we? Just as homeless can be. Oh, we're gonna get everything through our labor. Because union are we? Landless, landless are we? Just as landless can be. Oh, we're gonna get everything through our labor. Because union are we? Raggy, raggy are we?
Residential condominiums, you weren't joking.
Just as raggy can be. Oh, we're gonna get everything through our labor. Because union are we?
It's amazing. You want to talk about this building or that building?
Landless again.
Oh, this one?
Landless,
Whichever one you were going
are
for.
we, just as landless can be. Oh, we're gonna get everything for our labor. Because union are we? Homeless, homeless, homeless are we? Just as homeless can be. Oh, we're gonna get everything through our labor. Because union are we? Union are we? As union could be. Oh, we're gonna get everything that we labor. Because union are we?
So if you look over that side there with the nice fancy balconies over there, those are some of the, condominiums and whatnot that we have here in Lancaster. There's also many luxury condos on Lemon Street that are actually sitting empty, while at the same time we have a rise in our homeless population.
Shame!
Ain't no power.
Shame!
Because the power is stop.
We are on the 200 block.
Okay, how about this
So
one?
it's on the 500 block, so we have a few blocks.
Healthcare is a human right. Healthcare is a human right. Healthcare is a human right. Fight, fight, fight. 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 Housing 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 is a human right. Fight, fight, fight. Housing
Ain't no power like the power of the people, cause the power of the people won't stop. Say what? Ain't no power like the power of the people, cause the power of the people don't stop. Say what? Ain't no power like the power of the people, cause the power of the people don't stop. Say what? Ain't no power like the power of the people, cause the power of the people don't stop. Say what? Ain't no power like the power of the people, cause the power of the people don't stop. Say what? Ain't no power like the power of the people, cause the power of the people don't stop. Say what? Ain't no power like the power of the people, cause the power of the people don't stop. Say what? Ain't no power like the power of the people, cause the power of the people don't stop. Say what? Ain't no power like the power of the people, cause the power of the people don't stop. Say what? Well, I went down to the rich man's house and I took back what he stole from me. Took it back my dignity. Took back my humanity. And now he's under my feet. Under my feet. Under my feet. Under my feet. Ain't no system gonna walk all over me. Well, I went down to the rich man's house and I took back what he stole from me. Took back my dignity. Took back my humanity. Now he's under my feet. Under my feet. Under my feet. Yeah, under my feet. Ain't no system gonna walk all over me. UPMC? Well, I went down to UPMC and I took back what they stole from me. Took back my dignity. Took back my humanity. And now they're under my feet. Under my feet. Under my feet, yeah, under my feet. Ain't no system gonna walk all over me. Well, their office? Well, I went down to the welfare office and I took back what they stole from me. Took back my dignity. Took back my humanity. Now it's under my feet, under my feet, under my feet, yeah, under my feet. Ain't no system gonna walk all over me. ICE office? Well, I went down to the ICE office and I took back what they stole from me. Took back my family. Took back their humanity, and now they're under my feet, under my feet, under my feet, yeah, under my feet. Ain't no system gonna walk all over me. Rich man's house? Well, I went down to the rich man's house and I took back what he stole from me. Took back my dignity. Took back my humanity. And now it's under my feet. Under my feet. Under my feet. Yeah, under my feet. Ain't no system gonna walk all over me. Ain't no system gonna walk all over me. Come in again. Ain't no system gonna walk all over me.
We're almost there. We've got the rest of this block, one more block, and then we're on the block where the hospital is. So we're almost there.
All right, we have sounds like 1.5, 2 blocks.
Almost 2, yeah.
Not much further.
Yeah, you gotta see the top of the building.
Somebody. I am 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 somebody.
We're going to be right before the urgent, whatever in the hell they want to call that, because it's not really the place they tell the poor people they should be going instead of the emergency room. But the hours aren't convenient, and they only do so much anyway. Like Matt went over there and they sent him over to the hospital anyway.
Alrighty, y'all. So over on the right across the street there, you see a place called Rose City. It's kind of category there. If you look down here, you see the dental's office is kind of like a category across that. You'll see it as we get a little bit closer, and I'll point over to it. But it's the Rose City Nursing and Rehabilitation Home there. There was recent reports that came out about nursing homes. The thing about this one here is it was owned by a for-profit company, and then I believe like the governor and everything had to like step in because of the things that were going on in there. I mean, you had the workers basically put money together so they could buy 20 loaves of bread to feed the residents. You had workers using their own credit cards to pay for transportation so they could transport the patients. There were workers that, I think it was one that was diabetic, one that was an expectant mother who was like, her due date was at the end of that month, but because of what was going on with the for-profit company and waiting for like the whole governor and everything to sort of figure things out, they had lost their health care services because they were getting it through their job. So here, an expectant mother who was, you know, due to give birth by the end of the month didn't know what was going to happen, or if she would have her health care services covered during childbirth. So that's the kind of stuff that's happened. I would say within the last course of the year is when I kind of saw stuff like that coming out in the news about that nursing home. And then the recent reports that came out basically showed that nursing home still did not improve in their rating. So it's definitely something that is on our radar to watch the Rose City Nursing and Rehabilitation Center, as well as the other healthcare properties in our community. So I just figured that while we were walking past it, I just wanted to give a shout out to the workers and the residents of the Rose City Nursing and Rehabilitation. Yeah. All right. We are with you all in solidarity.
Thank you. Of the Poor People's Campaign that we understand innately is that society, the middle, the so-called middle, is being exploited as well, along with us, the poor, the homeless, the most afflicted.
Put people first!
Put people first! Put people first! Put people first! Put people first! Put people first! Put people first! Put people first! Put people first!
And so we understand that we actually need to stand together with the people who are struggling, because the doctors and nurses today are the homeless of tomorrow. So let's lift each other up. We are all going to suffer underneath this system. We need to invent a new morality. I like that. So there is a song that goes like this. So it's going to be, I'm going to lift my people up. They are not heavy. I'm going to lift my people up. They are not heavy. If I don't lift them up, and they will all clap 5 times. If I don't lift them up, clap 5 times. If I don't lift them up, we will fall down. No clap that time. Alright? Okay. If you don't get it the first time, it's fine. Just repeat. I'm gonna lift my people up, they are not heavy. I'm gonna lift my people up, they are not heavy. I'm gonna lift my people up, they are not heavy. If I don't lift them up, if I don't lift them up, if I don't lift them up, we will fall down. I'm gonna lift my sister up, I'm gonna lift my sister up, she is not heavy. I'm gonna lift my sister up, she is not heavy. I'm gonna lift my sister up, she is not heavy.
lift him up, if I don't lift him up, if I don't lift him up, we will fall down. I'm gonna lift my people up, gonna lift my people up, they are not heavy. I'm gonna lift my people up, they are not heavy. I'm gonna lift my people up, they are not heavy. Over. If I don't lift them up, if I don't lift them up, if I don't lift them up, we will fall down. Slow down. I'm gonna lift my children up, they are not heavy. I'm gonna lift my children up, they are not heavy. I'm gonna lift my children up, they are not heavy. If I don't lift them up, if I don't lift them up, if I don't lift them up, we will fall down. I'm gonna lift my people, I'm gonna lift my people up, they are not heavy. I'm gonna lift my people up, they are not heavy. I'm gonna lift my people up, they are not heavy. If I don't lift them up, if I don't lift them up, if I don't lift them up, we will fall down.
Super duper close.
Thanks everybody for watching with us.
Close, close, close.
Here, I'm going to lead a chant. LGH, we're outraged. You're taking advantage of Medicaid. 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 Thanks for watching with us and joining us outside Penn Medicine LGH. Did you know that Penn Medicine Lancaster General Hospital is the largest employer in Lancaster County? Absolutely. The largest landowner in Lancaster County? And they're a non-profit.
Thanks.
So they are not obligated to pay taxes. Lancaster General has been around for 125 years and was taken over by Penn Medicine August 1st, 2015. We're taking action and organizing to take back St. Joseph's. The hospital UPMC Pinnacle closed against the wishes of the community. The Lancaster Healthcare Rights Committee, Put People First PA, discovered disturbing healthcare practices at Penn Medicine Lancaster General Hospital, which is now the only hospital we have left in the Lancaster City limits. We're here to call out Penn Medicine for the false claims filed with Medicaid to demand staffing safe limits for workers. We stand by the healthcare workers in our community. We know that they do their best they can under the unfortunate circumstances in which they find themselves. Now we're going to hear from people who have been personally affected by the overcrowding of the emergency room and are concerned about over recent reports that are coming out. Healthcare is a human right. Put people first. Healthcare is a human right.
Put people first. Healthcare is a human right. Put people first. Thank you.
As a survivor and advocate for survivors of sexual abuse and domestic violence, healthcare is low on my priority, even though I'm 56. I've forgone dental care and screenings because they're too triggering because of my past abuse, and because I'd be forced to use Penn Medicine LGH as my provider for medical procedures. It's hard enough for survivors to go to the doctor and dentist because so much of the exams and tests are so similar to our abuse. And studies have shown how this abuse has lifelong effects on us. Not only, and our bodies and our minds won't let us forget. This should be the only hurdle that we face, and yet Penn Medicine provides an even greater one. They're not protecting their patients from sexual assault. Despite a long history of accusations of sexual assault of its patients, Penn Medicine LGH continued to grant this doctor privileges at the hospital, ignoring and failing to report his actions, both in this hospital and in his private practice. They also continued to employ a respiratory therapist who was known to sexually assault comatose patients.
Wow.
These predators were only stopped when nurses reported these crimes to the authorities. Due to their action, despite the hospital and all its staff workers being mandated reporters, Penn Medicine LGH is now under investigation by the state's attorney. Our first speaker is Ray. She's a new member of Put People First PA and a birth doula in Lancaster.
Woo! Right on!
She's going to talk to us about the egregious health care that at-risk pregnant Medicaid patients received at LGH that came to light only after a whistleblower doctor came forward.
Woo! All right.
Hi everybody, can you hear me? Okay, good. Okay, what is a doula? Everyone's like, what is a doula? Well, I'm going to let you know. A doula comes from the Greek word meaning woman, caregiver, or servant. From the beginning of time, women have been cared for and nurtured as they become mothers. Family, friends, and neighbors from the community would rally around the new family to help guide them in their early tender weeks and months with the new baby. As a birth doula, I provide continuous physical, emotional support, and I assist in gathering information for the birthing person and their partner during labor and birth. I'm here today because as a childbirth advocate, I'm concerned about women's health issues and the lack of emergency access for mothers within our community. I'm concerned with the closing of UPMC Pinnacle, Lancaster, which was located in an area where both urban and rural people, such as in the southern end of the county, had access to care. Now we are confronted with overcrowded waiting rooms where patients are waiting 8 hours to be seen or being sent home. We can't give our mothers a pill and ask them to go home and come back tomorrow. I'm concerned that transportation is also a problem. Taxi, Lyft, and Uber can be very expensive, so people may not be able to have their illnesses taken care of and they go silent and do nothing. When a birthing person is pregnant and is going to deliver, they need to feel confident in their provider and the institutions where they're going to deliver. Right here in Lancaster, mothers have had medical procedures done, such as sonograms. Lancaster's Penn Medicine didn't give the results of the testing to the parents in an appropriate manner, or maybe not at all. I'm concerned because a very crucial time for support for women is in their 4th trimester. The 4th trimester is the first 3 months after the baby arrives. Locally, LMP had a cover story in their May 8th edition regarding pregnancy deaths. Obstetric care in the United States stops after birth. That's the most crucial time for mothers and babies. For most new moms, the first time they see a healthcare professional will be on their follow-up appointment, which is 6 weeks. Maternal deaths in the United States occur from factors that arise during that gap in care. The United States has the highest maternal death rate of developed countries, and the rate is rising. 700 to 900 women die a year from pregnancy or birth-related complications. Worse yet, the risk of pregnancy-related deaths for Black women is 3 to 4 times higher than those of white women, according to the CDC. Massive hemorrhaging, blood clots, infections, and other heart conditions combined represent the #1 cause for maternal death. Preeclampsia, which is pregnancy-induced hypertension, is another. There's something profoundly wrong and awful that the fact that Beyonce and Serena Williams had to fight to have their health care concerns taken seriously during pregnancy, even with all their wealth and fame. I'm concerned because tragically, many of the deaths could have been prevented if we do not have that gap in postpartum care taken care of. How do we in Lancaster focus on this proportion of emergency care that is needed? I'm concerned that overcrowded, inaccessible delivery rooms can be dangerous and further contribute to the issues of maternity, mortality, and morbidity that disproportionately affect low-income communities. I'm concerned because women
need to have quick access for maternal emergency care here in Lancaster, especially knowing that the United States has the highest maternal death rate of any developed country. Communities suffer immensely. Lancaster County is suffering. It's time to stand up it's time to stand up to corporate greed. We're not broken, the system is. Woo! All right.
All right, everyone. So I'm going to introduce Matt, co-coordinator of Lancaster Healthcare Rights Committee, who wants to share personal experience that he has had at the emergency room and services care clinic.
Hey everybody, my name is Matthew Rosing. I'm a co-coordinator of the Lancaster HRC, a Mother Jones leader, and a member of the community care team. Okay. I'm speaking today on the crisis we face here in Lancaster with our healthcare system. Since the closing of UPMC Lancaster, we have been left with one hospital in the city. The treatment I received at Penn Medicine was anything but good. I went there to receive help for chest pains I was having and was treated like a nuisance. After waiting for hours to be seen, I received nothing but attitude and I don't care feeling. The staff was obviously busy and overwhelmed. They barely took any time to see to my needs. I also suffer from mental health issues that leads me to seeking treatment in the hospital from time to time. With 8-hour waiting room times and the attitude of the staff, I'm very reluctant to seek the help I need in the UPMC. The help I need. UPMC was my hospital. I was treated with dignity and respect any time I went there. They had an on-site psych facility that helped me in many ways. But now being left with only Penn Medicine, I have lost faith in that my needs will be met. And after learning of the despicable business practices of Penn Medicine, I am not willing to go there for any part of my treatment. When healthcare companies are more concerned about profit, it hurts the people. A hospital is supposed to be a safe haven, a place of healing and care. LGH Penn Medicine has become a place of greed. They are more concerned about putting fancy dining areas in their architecture in places and all over the place instead of healing. We call on Penn Medicine to return to the practices of helping and healing, not profit margins in real estate.
Right.
So the chorus goes, everybody's got a right to live. Everybody's got a right to live. And before this campaign fails, we'll all go down to jail. Because everybody's got a right to live. Do that with me. Everybody's got a right to live. Everybody's got a right to live. And before this campaign fails, we'll all go down to jail. Because everybody's got a right to live. Here we are in Lancaster, feeling mighty mad, thinking about the health care that we've never had. Because everybody's got a right to live. Everybody's got a right to live. And before this campaign fails, we'll all go down to jail. Because everybody's got a right to live. We haven't got much time left, the sands are running out. Peace, justice, freedom, you can hear the whole world shout. Because everybody's got a right to live. Everybody's got a right to live. And before this campaign fails, we'll all go down to jail. Because everybody's got the right to live. Here we are in Lancaster, full of hope and pain, to see if folks will listen or shut their ears again. Because everybody's got a right to live. Everybody's got a right to live. And before this campaign fails, we'll all go down to jail. Because everybody's got a right to live. Let's start. Everybody's got a right to live. Everybody's got a right to live. And before this campaign fails, we'll all go down to jail. Because everybody's got a right to live.
everyone. Thank you for joining us today for our event. Just kind of like as a shout out, if you're more curious about like who we are or want to get involved, you can check out our website at putpeoplefirstpa.org. We are also on social media, Facebook, Twitter, and Instagram. Our next Healthcare Rights Committee meeting in Lancaster is this coming Wednesday from 6 to 8 at F&M in Sager Hall. Just keep in contact with us for the room number. And also, again, like we said at the square, today's purpose was not only to hold Penn Medicine accountable for the actions that they've done, but to also kickstart a Lancaster Homeless Union, because we were joined in solidarity today with the National Union of the Homeless. So for anybody who's interested in learning more about the National Union of the Homeless or getting involved with jumpstarting the Lancaster Homeless Union, we are going to be meeting at the Community Mennonite Church at 328 West Orange Street. And we are roughly gathering there around 4:30, just as an estimate. So hopefully we'll see you there. And then Ann's going to end us out with a chant. Okay.
Put people first.
Put people first. Put people first. What? Put people first.